The University of Oregon Health Center provides medical services and healthcare for students. The Health Center has the opportunity to increase the number of students who get tested for sexually transmitted infections. In recent years, only a small percentage of U of O students have utilized the STI services, even though college-age students are at a much higher risk to contract an STI. Surprisingly, almost 10 million cases of STIs are diagnosed every year in 15 to 24-year-olds alone. The Health Center must effectively promote its services among a wider public to increase testing and lower STI rates among students. In 2014, the undergraduate student body consisted of almost 10,000 males and 11,000 females. Statistically, anywhere from 50 to 80% of college students are sexually active. Many students believe that they are immune to STIs, and so they do not feel the need to practice safe sex techniques. Last year, the Health Center created a free app called Sex Positive, where students can become educated on safe sex practices, learn about STI risks, and encourages open communication about sexual health. But even with this information, U of O students aren't following through and getting tested. The Health Center was originally founded in 1936 and has been growing ever since. Its latest renovation was in 2005 when 10,000 square feet of patient care space was added. Since its existence, the Health Center's primary mission has been to enhance the educational process by minimizing health-related barriers to personal development and learning. Their core values include collaboration, community, compassion, excellence, integrity, multicultural competency, personal development, and responsible stewardship. On the national scale, a student's decision to get tested for an STI is affected by the trending hookup culture and the messages that healthcare providers are sending to them. Hookup culture has normalized casual sexual encounters in college students. One study reports that 70% of college-age men and women engaged in a hookup experience, ranging from kissing to sexual intercourse. Out of those students, almost half weren't concerned about contracting an STI from their encounter. Healthcare providers are using shock and awe techniques to scare college students into changing their behaviors. Students claim that these scare tactics only increase anxiety and fear about getting tested. This fear is known as behavior aversion or the ostrich effect, and it causes students to bury their head in the sand and avoid getting tested. Let's take a look at the strengths and weaknesses of the Health Center and the opportunities and threats that it faces. Strengths. The Health Center is located on 13th, which is easy for students to find. The Sex Positive app offers students free information that's available 24/7. They provide free male and female condoms of all sizes and emergency contraception. Students can conveniently make appointments online, and they have the option of paying at the appointment or having the bill get sent to their parents. Weaknesses. Drop-in STI testing is not available. Scheduling advance appointments are necessary, which is difficult for a busy student. Unless students qualify for C-Care, there are fees for testing services and contraception. U of O Health Center received national attention for using a patient's health records against her in court and questioning privacy ethics. Based on social media and campus presence, Get the Vax is the most widely publicized health campaign on campus. Opportunities. Normalize open conversation regarding sexual health on campus. Emphasize the non-judgmental nature of campus clinics and privacy rights. Add drop-in STI testing and appointment scheduling on the app. Threats. The Health Center isn't the only place for STI testing in Eugene. Planned Parenthood is very convenient for students without cars. It is only 1.5 miles away and on the bus route. In addition, there are several local community and private health clinics that allow for more privacy and anonymity on the student's part. The prevalent social stigma about sexual health among college students can shame and prevent them from seeking help with their sexual health needs. In the past few years, only a small percentage of students have utilized the sexually transmitted infection testing services. The Health Center is looking to increase the number of students who get tested for STIs.
Don't have sex, because you will get pregnant and die. Don't have sex in the missionary position. Don't have sex standing up. Just don't do it. Promise? Okay, everybody take some rubbers.
Let's talk about sex, baby. Let's talk about you and when